Welcome to the Brownsville Minute, a community-conscious conversation and a platform that provides information, wellness, love, and unity all on a digital platform. And our goal is to try to make sure that our community residents are informed, conscious, and that we are connecting the dots on a virtual platform. The Brownsville Minute is designed for everyone. Please join us with the Brownsville Minute. Good evening, everyone, and welcome to the Brownsville Minute. I am thankful that today is the day that you have an opportunity to join us live. So thank you very much for taking time out of your schedule to join the Brownsville Minute. Tonight is something very wonderful that we are doing. We are continuing to provide different outlets and ways to provide information about our current state of the COVID-19 pandemic. We are still in the midst of it, even though things are opening up. So I am really grateful to have an opportunity to be able to share from one of the experts, because, you know, clearly I can share my experience, but I am not a licensed registered expert. I can just share my personal experience. And so tonight we are seeking to provide updated information and address any concerns that you all may have about the COVID-19 vaccine. I know that I chose to get vaccinated primarily because I didn't have a lot of information, but I knew that I wanted to travel and I wanted to have some sort of protection in my head. And I was terrified at first. And so this is not something that's an easy decision for you all. And so the goal is to provide, you as much information as you can, as we can, and share it as a community, all centered in love, because we know that this whole process has been very, very traumatic. And still, many of us are still dealing with the results of what has happened over this past year. However, there is hope and there is opportunity for us to become more informed to make our decisions. So I am, just really excited about the information that we are going to present. We are now a year in this pandemic, and we want to, discover together what we have actually learned from the beginning to now. We've all heard that most vulnerable populations, communities of color, have been impacted at a greater number than most. And tonight we're going to explore and address our community concerns as it relates specifically to the COVID-19 vaccine and what we can and should be doing to continue to protect ourselves. I'm excited to discuss with Dr. Simbo Ige, who is the Assistant Commissioner of the Bureau of Health Equity Capacity Building, which is a center for equity and community wellness that uses racial and social justice approach to eliminate health inequities for those who are most marginalized within New York City, and to reduce the overall premature mortality from the leading causes of preventable death, with the vision that every New Yorker will live in a thriving neighborhood with equitable access to resources that help support a healthy community, individuals, and also communities. And so would like to introduce to some of you, many may have seen Dr. Ige in other places, but welcome to the Brownsville Minute. I would love to bring to the stage Dr. Ige. Welcome. Thank you so much for joining us.
Thank you, Anita. Thank you, Brownsville. Thank you, everyone, for taking time out to join this conversation this evening. I am Dr. Simbo Ige. I am a public health physician. I am a woman. I am a mother. I have 2 teenage sons at home. I have parents. I am an immigrant, and I am a woman. So I have been at the margin of all the margins there can be. So I thank you for the opportunity to be part of the conversation and the space to share with you my work and my learning. So as Anita introduced, my work is to make sure those who are marginalized, those who are in the background, have voices. If it is a preventable cause of death, that is my work. If there is a gap between Black folks or brown folks and other folks, then it is my work. If there is a gap in education or information, then that's my work. So all the big English and words, health equity and all of that, that's what it means. Closing the gap, making sure that people of color, people who are marginalized, have information, have access, can stay healthy. So that's my work. So thank you for having me.
So may I ask, because typically we see lengthy bios. Tell us some fun facts that, those who are watching, that's not in your bio. Just a fun fact.
So it's been 20 years of me doing health equity work. I have worked in 42 different countries. And I like to say to people, if there is a vaccine and it has a name, I have taken it. And that's because I have had to go to different countries and there are different things, in different spaces. So for protection, and because I work in rural areas and working with communities around the world, I have had a lot of experience with vaccines and My background, my training is as a community physician. I trained in the UK, and so I am passionate about the community. I want to be there. I want to be on the ground. I want to be with folks having those conversations. So those are some other things that are not in my bio.
So I have to tell you, Dr. Ige, we have a group of young people from my SYEP. My ambassadors are watching, and
Hey.
they are they're putting up comments. So I'm going to periodically to make this a very informative and fun. Um, hey, Kiara. Kiara says, "Wow, just really impressed with your experience and background." And Isaiah, hey Isaiah, of 20, and they're using the emoji, so I have to figure out which one is which. So hey, so they throughout our conversation I will be posting and engaging our live audience so that they can be openly involved. So thank you for being flexible and joining this community.
Thank you. And thank you for the emojis. When young people send you emojis, that's like you're cool. Because I have two sons and they're like, you're not that cool. So I can go back and say I have emojis and wows. So thank you for making me feel welcome.
Oh,
Thank you.
and Isaiah says you're really dedicated to your work.
I know.
Very dedicated. So let's jump in just so that we can discuss the matter at hand. We're still in the midst of the pandemic, and for most there is still a number of concerns about the vaccine specifically. We've seen when we first started, there was it was fast and furious, and still is, right, happening. However, are there any things that we can learn from where we are a year later to now?
Um, yeah. So one thing that we know is last year when we started, we're all in the pool of despair. We had no solution. We didn't know where to go. We're just trying to understand this, crazy virus. And so when we look back, we're very grateful for all of the things that we have learned. I like to say that last year, April 8th was 2020 was one of the most deadly days. On that one day, there were 800 people who died in New York City alone. And this year, April 8th, the same day, the same time, the same season, that number was down to 32. The difference, we had a vaccine. So we are very grateful for how far we have come and how many human beings are now here with their families and their loved ones because we have a vaccine that could prevent them from premature mortality. So there's a lot of progress that's been made, and we're very excited about the progress. However, there is still a lot of work to do. I wake up today, I'm like, oh my gosh, can COVID be over? Can we just not have COVID? And we're looking forward to that future.
And so, since we are in the midst of the height of traveling, summer gatherings, though there are many who still choose not to be vaccinated. As I mentioned, my reason for getting vaccinated was simply because not really having a whole lot of information when I did it. Now that I'm a little bit more informed, is because I simply wanted to travel. I like to be very honest. It wasn't, simply because of, I thought about the protection of it. My husband is a first responder, so I saw in the beginning firsthand what that whole first wave was like, and it wasn't pleasant. Within our household, we actually experienced, my husband got sick, and I cannot tell you whether or not my daughter and I got sick from COVID, because we did not experience the same symptoms that my husband did. So even though now I'm vaccinated, I still, by choice, still walk around with my mask, particularly when I go into smaller spaces, supermarkets, still, etc. Is that in your opinion, still best practice? I know that there's been like a number of mixed reviews, or, I try to stay too much. I try not to watch the news too much, but I do read a lot. And
Right.
there's some mixed things. I mean, I've had people tell me, oh, you shouldn't wear your mask. And I'm like, I guess we have a short memory. So what are your thoughts on that?
Right now, of course, you can never be too safe right now. Uh, so still keeping your mask on is still a good thing to do. We want people to recognize and to know that the mask, the recommendation that you can go without a mask is only for those who are vaccinated. So when people say, oh, we don't need masks anymore, that is if you're vaccinated in certain spaces. If you're going to be out in public, in a crowd, on a bus, on public transit, if you work in a city office or on a workplace and you're going to be hanging out with several people, you still need to wear a mask. And so, right now we're not just at a space where we can say no one needs to wear a mask. So it is still good practice to keep your mask on if you're going to be in a crowd, if you're going to be indoors, with a lot of people and you don't know if they're vaccinated or not. So those are some recommendations. And now that we have variants, if you're older, have some other risk factors that put you at high risk of COVID, we say, please still keep your mask on. The risk is low when you're vaccinated, but it is not zero. So we just want folks to remember that. We've been wearing masks for a whole year. Some of us that are doctors who wore masks for many years. So wearing mask is not a bad practice.
And so may I ask, because I know that there are the type of mask, is that still important, or can you just wear a cloth mask, or just anything over your mouth? Does it have to be specific?
Right. Remember, what we're trying to do when we wear masks is to make sure COVID is transmitted through droplets. That means they're tiny, tiny specks of saliva that it travels in. So when you talk, when you sneeze, when you speak, when you eat, when you're singing, it can fly around. And so when you have a mask, the idea is to have it snugly over your nose and around your cheeks so that nothing is escaping and nothing is coming in. Right now, because we have a Delta variant that is more skilled at transmission, we recommend 2 masks, particularly if you're not vaccinated. Double mask, if you're wearing the disposable mask, then you should have 2 on just for an additional layer of filter. If you have the kind of mask that's called the KN95, it has a snugger fit and has that sort of pony peak to it that goes very snugly over your face. If you have that type of mask, you only need 1. So if it is KN95 mask, you only need 1 mask. If you don't have a KN95, then you can layer your mask. You can have the disposable and then a cloth mask on top of it, or 2 disposable. That's just to increase the filter layers for whatever is coming in and whatever is going out. The kind of mask that you shouldn't wear is the one with the valve. So if you have a mask that has a hole in it and that valve thing, that's not the best kind of mask. It allows things out. So it's not recommended. But those are the current guidelines for how we can stay protected if you're going to be indoors with a crowd or not vaccinated.
And so obviously the other, what we call in our house the common sense best practices, is when you come from outside to continue to wash your hands
Oh, yes.
with soap. I said with soap because I'm sorry. We've just had a number of conversations about, because I can remember, like, even when you go in specific spaces and you're using like public bathrooms and you just
Yeah.
have to notice that one is not really washing their hands, I get so stressed out because I'm like, if this was happening prior to COVID, like I don't know. It's obviously common sense, right, to us
Right.
to make sure that when you come into your home or wherever you are, to
Amount.
continue to wash your hands. And people are laughing in the chat because they know it's true.
Yeah, there is some people that just not very hand washing oriented. So we encourage you to wash your hands, and if you're somewhere where there is no water or soap, then having a small bottle of hand sanitizer uh, will also help. So hand washing, hand washing, hand washing, please. Still important.
So I'm going to look really quickly to see if there's any questions. Please feel free to ask any questions related to any concerns that you have about, this real and current, situation that we're still in the midst of and looking forward to a new day. So, Dr. Ige, I know that you have a presentation that just did you want to focus in on that at this point of the program?
Sure. I just wanted to show you quickly some numbers. I like numbers and I like visuals just to help people see where things are. I am particularly concerned about how COVID has impacted people of color in New York City. So I just want you to see a snapshot of some of the things that, give us a little concern. Next slide. Um, So this is what COVID has been like in our city. The first wave, the second wave, and the total number of cases we have had to date. Hospitalization, the first wave, we had a high level of hospitalization. That got better with the second wave. And then deaths, very high initially, and now with the second wave, lower number of deaths. Uh, so just to let you see that the second wave we still got as many cases as we did in the first wave, and now we are at the precipice of the third wave. So we just need all New Yorkers, everyone on board, and all hands on deck working together to prevent another trauma to the communities that have been impacted over and over again. It's not just COVID, it is racial violence, it is gun violence, it is, evictions and poverty and lack of job and education opportunities. We just want to prevent a third wave from impacting us. Next slide. And this is why it is important. When you look at the number of cases, look at Black folks, look at Latino folks, they were the most impacted. When you look at hospitalization, the same pattern. Those who are Latino, those who identify as Black, almost double the rates of hospitalization for other ethnic groups and racial groups. And then look at death rate, the same pattern. So we don't want history to repeat itself. We don't want a third wave to present the same kind of picture in our city. And that's what we're trying to solve for. Next slide. Next slide. Next. And this is how far we've gone in terms of vaccinations. Uh, there are a lot of people who say, I want to wait and see what happens. And I like to share these numbers because, when we say we're waiting, I don't know how many people know how many millions of people are in the United States. But we, as at, the 22nd of July, 339 million people have been vaccinated in this one country. We're not up to 400 million, that much I'm sure. So more than three quarters of people in this country have been vaccinated. Many of them Black, many of them brown, many of them of different ethnicities have been vaccinated. So just to reassure folks that vaccination is the norm rather than the exception. A lot of people have been vaccinated over this last 6 months. They are doing well. They are our friends, they are our colleagues, they are family members. We know them by name. These are not just numbers, these are real people. And if you bring this home, almost 8 million people, not 10 million people, I'm sorry, have been vaccinated in New York City again. So again, these are people that we know, these are neighbors, these are friends. So the question is, how are we telling the stories? Because social media, everywhere you turn, people are so afraid of the negative stories. There people are terrified of what the vaccine can do to them. Yet we have almost 10 million people that have been vaccinated and doing well. So how is it that we hear more about all the negative things and not about all of this positive things? And so that's what we want people to see, that so many people have been vaccinated. And this is transparent data available on the website, and the links are there for you to check it out. Next slide. But when we look at this number closely, yes, a lot of people have been vaccinated. A lot of them are New York City residents. But as of today, we still have 52.7% of New Yorkers are fully vaccinated. That means we still have over 40% of the population still vulnerable. And when we break that down on the right-hand side, that is by age, we see that those who are younger, we have lower number of people that are vaccinated. Young people, we tend to feel, those of us who are young, we feel like, we're protected. I like to think I'm young, so um, and sometimes we don't always consider all of the preventive strategies that we should use. And so we see that we have a lot of work to do. Those who are older, many of those who are 55 and older, more than 70% of them are vaccinated. But as the age, drops, we see that the numbers are lower. Next slide. If we want to stop transmission in New York City, then it means that we have to eliminate all the places that the virus can hide. As long as there are people who are carrying the viruses, then we're not out of the woods. And as long as people who are not vaccinated, then the potential for transmission continues to be there. So there is no herd immunity if most people are not vaccinated, because we continue to have opportunities for transmission, pockets of infection here and there. And another thing that is noteworthy is these maps show you two different things: one, vaccination rate, the other, death rate. So the gray one shows you the places where more deaths have occurred in New York City. And this is, the darker areas, that's Harlem, Bronx, Brooklyn, Southeast Queens, parts of Staten Island, the North Shore. And if you look at vaccination rate, we see the highest rate of vaccination in Manhattan. As at today, Chelsea is 100% vaccinated. Every single resident there is vaccinated. Hell's Kitchen, Financial District, 100%. Astoria, Queens, 100% vaccinated. And then we come to Brownsville, Bed-Stuy, we're still at 21. We're still at 2014 in some areas. So those are frightening numbers, because when we look at death rates in these areas, these were the places where people died the most. So if Delta continues to increase the way it is increasing, then so many people in our communities are at risk. So these are the things that we are worried about, and wondering how can we communicate, what kind of information can we provide? Does everybody know? Does everybody have information? Do they have the resources that they need to make a good decision? That's best for them in this situation. Next slide. So this is just
Okay.
just one.
Oops, sorry. Oh, you can't. Now you gave me the.
I'm sorry.
Sorry, everyone. My apologies. I will go backwards. Let's see.
Yeah,
My
just that slide where we see the things are increasing. Yeah. So yeah, this is where we are now. So first wave, second wave, and as at today, this is the first time we've seen more than 100 cases per day in the last 3 months. So we are climbing again, it's inching up again, and we are worried. Next slide. So, what do we know about the vaccines? How well do they work? We have clinical trials that shows that they were safe and they're effective. They work the same regardless of your gender, your age, your race, or ethnicity. Are they very effective at preventing severe COVID? And now we have real world data. I just showed you how many millions of people have been vaccinated. So if you go to the next slide, Miss Anita, so this is our actual data from New York City residents that have been vaccinated and the data of those who have been sick with COVID in the last 6 months. So in the last 6 months, 500,000 cases of COVID have been reported. Now, who are these people? 98.9% of those who have had COVID are those who are not fully vaccinated. 98.9. So who is getting COVID? Those who are not vaccinated. Who is being hospitalized? 98.4% of all the hospitalizations we have seen since January are among those who are not vaccinated. 98.9, that's 99% of all deaths have occurred in those who are not vaccinated. This is how we know that the vaccines work. We have not seen people who were vaccinated dying at the same number. So when people say, "Oh, the vaccines are scary. Oh, the vaccines are, killing people," this data doesn't show that. It shows that 99% of those who are dying from COVID are those who are not vaccinated. Not vaccinated. So where this information is public, is on the internet, is available for everyone. So when you see these things on social media, oh, the vaccines are killing people, this is the data. This is the data. Next slide. So people have a few questions. We are going to share with you some information that you can use in your communication that's simple and easy to understand. How were the vaccines developed so quickly? This is one thing that gives a lot of people concern. We just don't think this vaccine can work. We just don't think it's safe because it was developed so fast. And that's a valid concern. But why was it so fast? Because there was funding made available, because there was a head start. This is not the first coronavirus we're dealing with. Number three, because there was cooperation. People shared data. All countries in the world were impacted. China shared what they knew. Everybody who had COVID shared what they knew. And based on that, that information helped to expedite things. And then there were volunteers. The clinical trials had 40,000 volunteers for Pfizer, 44,000 volunteers for Johnson and Johnson, 30,000 for Moderna, including people of color. People volunteered on social media. I want to be part of the trial. I want to be part of the trial because people wanted this pandemic to be over. On a good day, to get 40,000 people volunteer for a clinical trial, it will take you years. This is the reason this got done so quickly. And again, remember, it only takes 14 days for you to know if you have COVID or not. It doesn't take a year. It's not like HIV that you can get infected and then it will take 10 years for the symptoms to show. It only takes 14 days. So I know pretty quickly if the vaccine works or not, if I'm exposed. These are the reasons why this was an expedited process. There was no shortcut in the process. Another question I want to highlight for you. Next slide. People also ask, are the vaccines safe? We say yes. Then people say, how do you know it's safe? One, I have been vaccinated and I'm here talking to you. I'm not a ghost, that's for sure. Anita has been vaccinated. I have friends that have been vaccinated. I know people have been vaccinated and they're doing well. So I have the personal knowledge experience, but we also know that these vaccines, it is documented that this vaccine has been the most rigorous, scrutinized vaccine in the history of the world because every country is impacted. Everybody wanted a solution. So strict safety standards were followed. They monitored for any severe allergic reaction. It is very rare. They monitored for side effects. It is very rare. And the vaccines have been shown to keep people from dying. So this is how we know it is safe. There is no side effect of this vaccine that is worse than the symptoms of corona. So the things that will happen if you get sick and you compare it to the side effects of the vaccine, it is not comparable. 1 out of 4 people who get COVID, even after they recover, have long COVID, including mental health symptoms. People are not able to come to work. They're not even able to get out of bed in the morning because of the fatigue, day after day after day, even after they recover. So it is a bad disease, and now we have a solution. Next slide. How do the COVID-19 vaccines work? People ask that question a lot. We also have a flyer. These vaccines, the information on how to produce antibodies. Antibodies are what help us fight germs. So when you get sick with COVID, you develop antibodies, and if you're able to fight off the germs, then you recover. But there is a shorter way, faster, more efficient way to develop antibodies without actually being sick, and that's through vaccines. So the vaccines teach your body to develop antibodies without being exposed to COVID. I like to tell people is like having the playbook of your opponent if you're used to football. The playbook gives you the step-by-step play of your opponent without you having played the match. That's what vaccines do. They tell you step by step your body produces the antibodies without being exposed to the virus. And once that instruction is decoded by the body produces the antibodies, then the messenger is eliminated. So these vaccines do not linger in your body. People say, oh, maybe something is going to show up 5 years later or 10 years later. But the vaccines are eliminated from your body within weeks. Once you develop antibodies, the messenger is eliminated. The vaccines are just messengers. They just teach your body to produce antibodies. And once those antibodies are produced, the mRNA is eliminated. It doesn't take over your DNA, it doesn't take over your cells. It is eliminated. And that's it. And now your body knows how to defend itself. If you experience COVID in the future, then your body is prepared. It has antibodies to fight it off. It is the safest, easiest, cleanest way to develop antibodies without being sick. So that's how the vaccines work. Next slide. So, vaccines are available everywhere. Right now, you can even have a vaccinator come to your home. You call Vax for NYC at this number. Someone shows up at your house. You sit on your sofa. You get your shot in your arm. You say bye. Easy peasy. You can walk up to any vaccination site. You don't need an appointment. You don't need any documentation except to show that I am at least 12 years old and I am eligible for vaccination. We have mobile vans, we have buses, we have events all over the city. So we will try to make this convenient for people. So if you say, I'm so busy, I can't take time off work, someone can come to your home on a Saturday, on a Sunday, and make the vaccine available. And so if you have any questions about this process, about how all of this works, we have community conversations like this, making sure that all New Yorkers have information that they need to make the right decision about this process. Next slide. And that's it. So I know you still have a ton of questions. And if Miss Anita will allow me, I will still be here to respond to those questions.
Oh, I don't want you to go anywhere because I am not the expert. I'm not the expert. So I have a question that one of my young people text me, didn't want me to publicly put them out, about the question of hearing that the vaccine may cause issues with menstrual cycle, issues with like fertility. Would you be able to elaborate whether that's a myth or not?
I will tell you that I have two colleagues who are pregnant right now, and they got vaccinated 2 months ago. So if I'm going to go by that alone, I will I think this vaccine is really making people get pregnant. But that's that's a joke. The truth of the matter is, people are getting pregnant. People are having families. There were people who got vaccinated and then realized 2 days later that, oops, I'm pregnant. So this vaccine does not affect your fertility. There was an actual study done that looked at sperm count in men before vaccination, after vaccination. There was no change. We have seen there is a pregnancy registry, and over 30,000 people are on that registry that have been pregnant. either before, during, or after their vaccination, and they're doing well. It doesn't affect the baby, it doesn't affect the mother. Again, if 334 million people have been vaccinated, you can bet your dollar that there are pregnant people in there. So, nothing to worry about. Affecting menstrual cycle, we don't have any data that has shown that. So, we just don't have anything to support that that actually is the case as of now. So that's what we know about how the vaccines work. Again, I always say to folks, remember, if 340 million people have been vaccinated, there is a lot of information available out there about how the vaccine truly works.
Okay, thank you for that. So I'm looking in it, and please feel free if you are um, watching live. We will be bringing in your questions to answer. So I am going to start with a question about, let's see, about is New York City going to have a passport app, meaning for
Vaccine?
vaccinations to be.
Oh, yes, there is one already. There is the Excelsior app. I have it on my phone. So if you're vaccinated, you can just go to the Store, App Store, and download the Excelsior app from New York State, and your vaccination record will be there, and you can have your QR code and show it, and it can be scanned anywhere you go. That's in case you lose your vaccination card, or you just want an e-record of your vaccination.
So thank you for answering that. And so Kira says, I have a friend who was pregnant when she got the vaccine, and she and her baby are perfectly fine. So thank you
Thank
for
you.
sharing that.
Yeah.
And
We need
so,
more positive stories so people know it's real.
hi, Roxanne. How important is it for teens to get vaccinated?
I am going to share with you a very sad story. Um, so I have a family friend, a 16-year-old daughter. She got sick. All the other members of our family got sick. Dad, mom, two siblings, all of them got sick with COVID. They all recovered. Unfortunately, we lost this young lady, age 16, athlete, top, tip top shape. So, just to let you know that yes, young people are at lower risk, but this virus, there is no one that is completely immune. So, we want to say that yes, people still do get very sick, and we have lost some young people to this virus. Uh, in addition to that, another concern for teenagers is that the risk of transmission continues to be there. Even if you don't get very sick, if someone else comes into contact with you uh, and you're sick, then they're at high risk. Nobody wants to be the reason why their 85-year-old grandmother got COVID. So if we can protect as many people and limit the spaces where the virus can hide, then we're all the better for it. So we encourage even teenagers to get vaccinated, and it is safe for them. So that's the recommendation.
So thank you for that. So I have another question. Is the vaccine safe for small children and toddlers?
Right now, the study is still ongoing. The way things work, the vaccines will be used by adults. You'll monitor it and say, okay, it's good for adults. It's everything is fine, and then you go to children, to younger people. Among teenagers, the vaccine was found to be 100% effective, so it produces a better immune response in young people than it does in adults. In adults, it's like 95% for Pfizer, and in those who were 12 to 15, it was 100%. Not one of those who were part of the clinical trial got sick with COVID after getting the vaccine. Now, but for those who are younger than 12 and 10, the studies are still ongoing to see how the vaccine works in them. And we're hoping that soon, yesterday there was an announcement that maybe even before fall, the vaccines will be available for younger children. But for now, we're still waiting for the clinical studies to be concluded.
And so as a follow-up, is there any data that the vaccine is safe for children with learning disabilities?
We don't have data for children yet. The studies are still ongoing. But I can say what we know about adults. So, adults with learning disabilities, there has not been any negative impact. And for other types of disability, there has not been any negative impact there as well. The good thing to know about this vaccine is it doesn't contain a live virus, so it's pretty safe. So, for those with immunocompromise, we don't have any interaction with an underlying condition, at least for Pfizer and Moderna. For Johnson and Johnson, there are some exceptional cases, but for Pfizer and Moderna, we don't have any what we call absolute contraindication, like this group of people should not get vaccinated or the vaccine hurts this group of people. We don't have that. So disability, learning disability, is not a problem.
And so, as a follow up to and thank you for your questions. Please keep them coming. I know that we're in a digital space, so typing is slow. So, the follow up question with regards to the app, is that only for state sites, not pop up sites? And with regards to the app?
No, it's for everyone who's vaccinated, regardless of where you got vaccinated. When you download the app, you put your name in the system and the date of your vaccination or your appointment number or what have you, your name and your date of birth. It will bring out your record, and you will be. So it doesn't matter where you got vaccinated.
And I appreciate that. And Isaiah says his grandma sprays him every time she comes over. I guess to make sure
Yeah.
that for protection. And so let's kind of unpack what that looks like. I know that we are attempting to try to ease some of the concerns, but we talked about the mask, the hand washing, the protection of and practices that we use to kind of protect ourselves. Like,
Right.
is that overkill, or is it just like, something that we should, again, for our level of comfort and understanding, continue to do?
So if you think about how COVID is transmitted, it's transmitted in droplets. When you're talking, the little specks, they're flying here and there. When you're singing, when you're eating, when your mouth is open, when you're sneezing, this is how these things happen. So spraying will not necessarily stop that. Spraying will help eliminate from surfaces. So if you talk and there are tiny specks and it lands on a surface, then spraying and wiping that down, yes. But spraying will not stop person to person transmission if you're in close proximity. So that's where the 6 feet distance came from, that droplets cannot travel too far. So over a 6 feet distance, usually it will fall to the ground before it gets to the other person. So it is not airborne. It is transmitted in droplets. So it is suspended in those little specks of saliva. So it doesn't travel really far, which is why the social distancing uh, recommendation helps. So in such instances, social distancing will help. Wearing mask will help. And then if you touch anything or washing your hands will also help so that you're not transmitting the virus from a surface to your face and breathing it in. So those are the reasons for those precautions: social distance, wearing a mask, washing your hands. Uh, those are the things that we've seen to limit the chances of transmission.
And so great. Appreciate all of the questions, and I'm just going to check again to see if I missed anyone. Um, Someone says they carry a small bottle with 99% alcohol in it and just spray everybody. You see my group. They are just something amazing.
Yeah, but there's some things that you do to just make yourself feel better. It works, it doesn't work. So, but I don't want you to lose sight of the things that will work. If you're outdoors, if it's going to be a crowd, if you don't know if the other person is vaccinated, please keep your mask on. What we know for now is that we have not yet seen a case of a vaccinated person transmitting infection to another vaccinated person. We have not seen a single case of that yet. So if you're vaccinated and you're with another vaccinated person, then you're good. But if you're vaccinated and you don't know if the other person is vaccinated, then it's best to keep your mask on.
And so I have a follow-up text because they trying to remain anonymous. So I'm respecting privacy.
Oh, yes.
So for the question is about helping to build your immune system and eating the appropriate things to help build. Would you be able to lend any words about the importance of, because there are those who are they just don't want to do the vaccine, even though this is something that you have described within your information as something that can support to turn this curve. What about all the wellness and all of the natural stuff that's out there? Any thoughts about that related
Yes.
to building your immune system?
Yes. Generally, eating fruits with and vegetables with antioxidants, 5 servings a day is good for anybody at any time. Will it protect you from COVID? We have not seen an evidence of that. Taking vitamin D is good if you're deficient. Will it prevent COVID? We have not seen any evidence of that. Oh, I take all these herbal remedies. I take, ginkgo biloba. I take this and I take that. Is it good? Sure. Does it prevent COVID? We don't have evidence of that. So the reason why we say we don't have evidence is that the way medicine works, you have to demonstrate proof. You have to give that thing to that person, you have to monitor it, and you have to be able to say, yes, it prevented. We have not seen that happen. We have seen COVID happen in people across the board, eating well, staying well, fit, no underlying condition, still got COVID. So we want people to know that as at now, as at today, we don't have any evidence that these things prevent COVID.
But what we do know is, the importance of doing the basics as we discussed, maintaining masks, washing hands, and also practicing, 6 feet physical distance, specifically if you're in closed space and you don't know whether everyone is or is not vaccinated. So
Right.
I do not see any more questions. And so I want to allow for you to provide any last minute thoughts to wrap up our segment this evening.
Yes, thank you so much for this opportunity. I want to say to anyone who's in the room, if you're vaccinated and you feel comfortable sharing your story, please do so. People are terrified. People are worried. People don't trust the information they're getting from, the TV or from the media. But people trust their friends and their neighbors and their family. So, because those who are spreading misinformation are very aggressive about doing it. There are people who post 10, 20 videos a day of made up stuff. And yet there are so many people who are vaccinated are doing well, and people don't hear those stories. So we just want to encourage you to share your stories with as many people as you can. When people are worried about the vaccine, what reassures them is people they know, people they trust, that have been vaccinated, that they can see and can touch, and they know, and they are doing well. So I think that's what's most reassuring to people. Uh, so we encourage you to share your stories in any way that you feel comfortable, just to help people know that people are out there who are vaccinated and are doing well.
And so I do have one more question that popped up. This person is texting me. I'm like, come on, come on live. So about what would one experience about when they go through to get vaccinated? So you did mention that there's a number of different options now available, coming in home, going to an actual site or other
Right.
facility. What would be the experience? You obviously go and get,
Right.
shot, etc. Like, would you be able to to describe for those who may be on the fence or not?
Yeah. So I'll describe the experience, which most people will have. I took my, 15-year-old to a Walgreens to get vaccinated. It wasn't as a hospital or anything. We just went to the nearest Walgreens near us. So if you walk in there, you will fill out a form with your name and saying you give consent to be vaccinated if it's a child under 18. And then they go in, they get the jab. You're provided a chair, you sit, and they observe you for 15 minutes to be sure there is no reaction. And then you go. If you're older than 18, then you can walk in. The whole process takes less than 5 minutes. Um, if you're older than 18, then you don't need anyone to sign consent for you. You show your ID or any proof of age. Like, this is my age. I am older than 18 years old. You fill out the form with your name, an address on it, and then they ask you if you have had any allergic reaction to the vaccine before. You say no. Then you go get the jab, and you have to sit for 15 minutes for you to be observed. So there is no allergic reaction. If there is an allergic reaction, you're treated there. But for most people, allergic reactions are very rare, 1 in a million, 1 in 2 million. So most people don't have an allergic reaction, but they still keep you for 15 minutes to be sure. And then that's it. Then you show up in 3 weeks for your second jab, and that's it. Most people will feel the soreness in the arm. When you get a needle stuck in your arm, it's going to hurt. And that arm may be sore for a couple of days, mostly the second day, and then by the third day, you're fine. For some people, they feel like if they need to put ice on it to just make it feel better, that's fine. Some people feel like they want to take Tylenol or Motrin or Advil to help with the soreness. That's also fine. Um, and most people are up and about, about their regular business in the next day or two. So now there are a few people that may have a headache or feel tired the day after the vaccination. If that's you, rest. Take Tylenol if you have to, take Motrin if you have to. Most people find they don't need it. And by the third day, most people are good and doing well. Usually those kind of symptoms happen after the second dose, but usually lasts a day or so, and they're fine. When I took mine, I had the headache. I had to take Tylenol, but I still went to work. I wasn't like down or anything, but I felt that headache and the soreness in the arm. I have a twin. Uh, she was good. She didn't feel anything. She was up and about. Um, so when my mom took the vaccine, she was very, very, she was very, very hesitant. I encouraged her, like, Mom, I'm a doctor. I will not let anything bad to you. I won't recommend something. I'm like, no, I'm not doing it. So she waited for me to get vaccinated. And I got vaccinated. I got my second shot. Like, see, Mom, I'm fine. Everything is good. And then she went and got vaccinated, and she didn't have anything. She was, no soreness, nothing. She was good. So sometimes it just helps when you see somebody else that you know and trust, and they're vaccinated, and they can go with you to help you feel, more at ease if you're worried. That's it.
I took my 6-year-old daughter with me, and she held my hand just because I, and we wanted to go into a CVS because at the time I got vaccinated, it was just a really long wait, and then it started to be distributed in the local pharmacy. So I too took advantage. I went to CVS, but I took my daughter with me, and she held my hand, and she watched the whole process. It's just a needle thing for me. It's not
Right.
about anything else. And I do agree. I did experience the soreness. And it was, it is in the muscle area.
Right.
So I'm a side sleeper, probably way too much information for you all. And I forgot. And so it just irritated, that side because that was my favorite side. But I appreciate you, for taking the time out of your busy schedule, and would love to have you back on, as more information comes out and your schedule permits. But I did want to make note that if you are interested and you want to make a decision to do so, down scrolling across the bottom, there is information where you can access information about how to go get vaccinated or have them come to your house. I mean, had I known about the had to come to your house thing, I just would have had like the cutest pajamas on. Got myself vaccinated because
Like,
yeah.
oh,
So,
vaccination sleepover. Call all your friends. Like, let's have a party.
oh goodness. So as we wrap up, I always like to wrap up with some really fun one-word rapid questions of all of my guests, just to kind of lighten the mood. So what's your favorite borough?
Are you asking me that?
I'm asking you that. What's your favorite borough?
You want me to say on live what my favorite borough is? No, I don't want to be partial.
Okay, fine. I'll say Brooklyn because I'm from Brooklyn. I'm from Brooklyn. So what's your favorite food?
That will be. I like I like fries a lot. Um, I try to convince myself it's healthy by air frying it, but I can eat a tub of fries 3 times a day. I just love fries.
And so what about is there a favorite option between smoothies or ice cream?
That's not fair. I love ice cream, but I do smoothies. But my favorite option has to be ice cream. I'm sorry. I'm a doctor and all, but I just love ice cream.
And Isaiah goes, smoothies for sure. I hope I'm reading the
You're a better person than I am.
sure. So what about your favorite exercise if you do exercise?
I like to do yoga and Pilates. I do that, 2 times a week Pilates, and I do my yoga every day.
And so what is the legacy that you envision for your family going forward? Because I know that you mentioned you had 2 teenage boys.
Yes. I hope that they can um, have a future ahead of them where they feel empowered, emboldened, and feel like they can achieve whatever they want, regardless of their color. That's what I hope that that their future will be.
And see this, I'm gonna bring in my community because they always got to cut up. So here it goes. If you dip your fries in vanilla ice cream, it will change your life, but you didn't hear it from me.
Oh my God. Oh my God. That is sinful.
See what I mean? My
Uh,
team. But hi, Melanie. Good to have you join us this evening. Thank you so much for this community discussion. I do hope that after this webinar, people who might be in doubt would get the vaccine. And that is our hope. But again, we are not looking to, um, demonize you because you did not. It is simply, this platform is really just an opportunity to make an informed decision. And we want to make it not light, but just that it's having a comfortable conversation from an expert and from someone who we both, had taken the vaccine. However, I did not go to school and I do not have the vaccine experience that Dr. Ige has, clearly. So on that note, I want to thank you so much for taking time out of your schedule. And I want to say good night to you. And thanks again. Look forward to having you again on the show.
Thank you for having me. It's been such a pleasure. And thank you, everyone, for being such a wonderful audience.
All
Thank
right.
you so much.
Take good care. And so it is really, again, about, as we talked about, providing and sharing information. It is not to force anything down your throat. Again, the goal of this platform is to make sure that we share information so that you can make an informed decision. It is really important for you to decide what's best for you and your family. And we want to make sure that you are all remaining safe. So if you do choose to do so, there are a number of different options, particularly within the East New York and Ocean-Hill Brownsville area, that are providing free vaccinations. So there's a wide range of opportunities for you to do so. And now you can have them, if you want to be in your PJs and do it, you can have them come to your house, which I thought, wish I would have known that. But anyway, so on that note, stay tuned for the Brownsville Minute. I am excited because we have a lot more in store for you over the next couple of months. We will be bringing more programming and more educational information in bite-sized pieces so that it's easily digestible and that you can share with your family. And on that note, I'm going to share the community announcements. Stay tuned for the community announcements as we have a lot of wonderful events that are Ocean-Hill, East New York specific, that we want to share and want to ensure that you take advantage of. So thank you so much for joining us, and stay tuned for the announcements. Bye-bye.